welcome back to Own Your Career. This is Rod Cologne with my buddy for a couple of years, Dr. Joseph Rosado. And you talk about networking and just staying in touch. And for years, we've just been connecting and texting and LinkedIn. And whenever I get a chance to be in Florida, we connect. And the beauty of networking is that you never lose touch. That even if you haven't spoken to each other for months or years, you always circle back, and it's like, man, you never missed a beat. And just welcome to Dr. Joseph Rosado, who we were in band class in high school. And how you doing?
Yeah, good, man. That was a long time ago, 1977,
Yeah,
76, 77. We were in band.
that's right,
And
man. You
Ricardo
you you
Hayes.
you you're the drummer, and I was the trumpet player, which is awesome. So you're the one of the first individuals I kind of really knew about this whole cannabis area, and we've at least over a decade. I remember talking with you about it, and now it's
Yeah,
everywhere,
yeah,
everything, and you're main speaker at all these different symposiums and overseas as well. So you know that over the last, oh gosh, 10 plus years, I've been working with students and professionals in managing their careers as this great enterprise, this greatness inside them. But as we navigate our careers, our Me Inc. enterprise, we struggle with that. And by struggling with it, sometimes it's mental, sometimes it's judicial. And so, what would you recommend for an individual as they're managing your career? First tell them a little bit about yourself, and then just how does that and what you've been doing help from a mental wellness standpoint?
sure, absolutely. So I, from a very young age, knew that I wanted to be a doctor. I just went a long way. So I started out as an orderly at the age of 16 because back then you could be an orderly at the age of 16. And so I did the training in high school. Uh, I did one semester, got my CNA, certified nurse's aide slash orderly certification, worked at a hospital as a transportation orderly, transporting people to and from their rooms to the X-ray department and vice versa. Then from there, I became an EMT, emergency medical technician, working on an ambulance, then became a paramedic, then went on um, and became a cath lab technician, then went to chiropractic school, then I went to medical school. So medical school was my fifth, sixth career, if you will. I was already in my mid 30s. I was a father of twin daughters. They were a year and a half at the time. But as you saw in the trajectory, everything I did was to improve, to gain greater knowledge or be able to provide greater service to my patient. And once I got to the chiropractic, and I interviewed at a few medical schools and osteopathic schools, their attitude was, well, you're already a doctor. Why do you want to be a doctor? I'm like, well, I want to be a medical doctor. I want to be able to provide more services for my patients. And the attitude was, well, if you come to medical school, you're already a doctor. So if you can't hack it, you got a backup. I'm like, why are you judging me? You don't know me. Like, and so that's when I said, you know what? Screw this. And I chose to go abroad. I went to medical school in the Dominican Republic, and then I did my training in Puerto Rico. So came back to the States with my MD, with my DC, with everything else. And then beyond that, I went ahead and got my MBA in healthcare management because in medical school, in all those years of training as a physician and a nurse's aide and an EMT and a paramedic, I didn't know crap about business. And that's where you and I connected in 2005 was when you and I reconnected through Jesus Lopez. And at that time, same thing. I was just finishing my MBA, and that's when you were educating me on the whole networking process and owning your career and being the CEO of Me Inc. But there were some dry spells there. Everything wasn't great like it is now, where I'm on the stage and people pay my flight and pay my hotel and pay my meals. I was sucking wind. And that stress and that anxiety that people have, especially as a male Latino, that we're raised to be the provider, to be the head of the household. I've got, at the time they were twin daughters. Now I have four grandchildren from each one of, from the girls. And so it's like, holy crap, now things are a little different. And, we can sit down and we laugh about it. But, 20 years ago, there was a laugh about. And so that's where the cannabis really helps to be able to
Mm.
address that anxiety, to be able to shut your brain down when you go to sleep at night. Because if you're thinking about how the day went, where you messed up, what you could have improved upon, or what you got to do the next day, you're not getting the rest that you need. And if you're not getting the rest that you need, your body's not recovering, you're not recouping. And because we're, multi-ethnic, we're Africans, we're European, we're Indian, indigenous. We have a lot of history within us. I did a lecture last week to in Washington, D.C. For a group of Native Americans, and the topic was on post-traumatic stress disorder and how cannabis is used to manage and treat PTSD. And most people understand and know post-traumatic stress disorder to be something that you experience. Either you experienced it physically or you saw somebody go through it. Like this morning, first patient of the day, 50-year-old female that had been abducted and gang raped in her abduction. And so she lives with that stress and trauma on a daily basis because of what she experienced. That is the classic definition of PTSD. But now, through research and studies, they found that it can be something genetic. Two genes have been linked with, causing you to have or be predisposed to have anxiety, depression, and PTSD. Add to that the intergenerational trauma that we carry from our parents, our grandparents, our great grandparents, that is passed down genetically in our cellular memory and what we deal with now and what we passed on to our kids. And when I mentioned this last week in DC, there wasn't a dry eye in the audience because every one of them in some way, shape, or form could totally relate and understand because their grandparents are alive, their great grandparents are alive, and they're hearing all this stuff that they went through. So imagine you're carrying all this stuff and then you can't find a job, or you're not qualified, or you're not old enough. One of my nurse practitioners that works at one of my clinics, she's got a daughter that did dual enrollment. She graduated from high school with an associate's in college already. So when she went to college at 19, she graduated with her bachelor's at 20, 21. She couldn't get a job because you're too young. They told her you can't even drink, you can't buy alcohol. How am I going to hire you to be managing a multi-billion-dollar company? And so that's where what you bring to the table, Rod, and what you educate people on being the CEO of your company helps you and educates you on being able to deal with that. And then on my side of the fence, I'm helping you be able to manage your stress, your anxiety, the depression that comes with being rejected, because getting rejected is not for the weak,
Orlando a couple of weeks ago, and they had many breakout sessions. But one breakout session that was wall to wall, standing room only, was the breakout session around mental health.
Yeah.
I mean, so it's as a baby boomer, it's not something we would have talk about in the past. But it seems to me that the Gen Zs and the Gen As are much more comfortable about that. So where all the other breakout sessions was not that packed. Why is that? What's I just sense it as a change. There's just a difference in culture now about mental health and from that perspective.
Well, one of the things that we can thank for that was COVID, the pandemic. We're social beings. We're used to being social and socializing. And for a year and a half, we were all locked up. We were on lockdown, for lack of a better term. And so from that point forward, people started understanding and embracing the reality of anxiety, the reality of depression, the reality of not being able to leave, the reality of wearing a mask and being ostracized because they made it a political issue and not a health issue. You know, I've traveled abroad. As you stated, at the introduction, I've been to Japan. I've been to India. I've been to China. People walk around with masks because of the high level of contamination and pollution. No one's calling them a Trumpster. No one's calling them a Republican or a right winger or a left wing. Nothing. It's for your health. It's for your protection. That people villainized it, well, that's on them. But that level of stress and anxiety and the bombardment and the constant attacking that was going on, but also having your loved ones getting sick and possibly dying. You know, parents and children, children were sick, mom and dad weren't, they had to quarantine. Now they're living in the same house, but they can't be at the dinner table together because the kids are sick. So the kids are in their rooms and mom and dad are bringing the food to the door, knocking on the door and then running back. You know, when I contracted it, you know, my then wife and I both got it at the same time. I was living upstairs because we had a two-story house. I was living upstairs. She was living downstairs. Thank God for Uber Eats, and no, we're not being sponsored by Uber. So you gotta do the disclaimer. We're not getting any money from them, but we would call Uber Eats and we would see each other as I would come out the garage door and she would come out the front door and we'd see each other and wave and then she'd go to her room and I'd go upstairs.
With, you know, the way the economy is going now is there's a good sense that there's going to be a lot of downsizing going on, and both in a federal and private sector. And typically when and I'm working with a few individuals right now that they've been downsized and caught them off guard. They weren't ready. They're not ready. There's no backup plan, and you could sense that desperation, like
Hmm.
they're freaking out, that they've lost their identity, which is the company. So as I'm working with them, I'm giving them the process, the methodology, and this is what you need to do. And I show them on the screen, with Gemini and
Hmm.
LinkedIn and all that good stuff. So I'm showing them step by step what needs to be done, and giving them this degree of hope. But they're so fragile. I could sense the fragility in each of them. Um, so if you were to guide them through this path, right, of you know what would you recommend from a mental health perspective, that someone who's just got punched in the gut multiple times in a short period of time, and they're like almost clueless as to what to do, and and everything that has to go on, from networking, interviewing, writing your paperwork, has to be with an image and a sense of, I'm worthy. I have a cause.
Right.
I've had great experience.
Yeah, I bring value.
Boy, that's you bring value, and they struggle with that. Um, how would you approach helping that individual? You know, one spoonful at a time, with your experience.
Well, I would first find out how experienced they are. That's the first thing. For example, my 84-year-old mother, who's still alive, had a stroke in June, but she's still alive and kicking. She's never smoked a day in her life, never smoked even a cigarette. So for me to tell her, oh no, you need to vape, this e-cigarette, or let me get you a pre-rolled, cannabis cigarette, as we called them back in the day, a joint. It's like that's the furthest thing from the truth for her. But what is she accustomed to doing? Making teas, because she's Puerto Rican. She knows how to make teas. So I teach her how to make the teas with the cannabis that she can drink throughout the day. It's not making her high. It's feeding her what's called the endocannabinoid system. You know, in basic biology that we took in high school, and then all of the advanced anatomy, physiology courses that I've taken, never did I learn about this endocannabinoid system, a system that's in all of our bodies. All vertebrates have this system where we produce cannabis, and those substances work on the receptors in our bodies. As we age, or as we're stressed, or as we're in pain, we produce less. And so we end up with what's called clinical endocannabinoid deficiency. And the only way to offset that is by using cannabis from the outside in and replenishing what we've lost. So we need to find the mode of administration that resonates best with the individual, that works well for them. For example, today I saw a young lady that has lupus, that has rheumatoid arthritis, that's on chemotherapy for these autoimmune diseases, that has severe asthma, that won't smoke, can't smoke because her pulmonologist has told her that she can't smoke. Okay, no problem. We have a meter dose inhaler that looks just like your albuterol inhaler that you can just spray into your mouth and goes into your lungs. And now you're able to receive your medicine and have the effect within 3 to 10 minutes. Contrary to eating an edible, that they're great, but it takes 2 to 3 hours before those are metabolized in your system. If you're anxious right now, if you're on the verge of having a panic attack, or you've had a panic attack and you need to break that, you can't wait 2 hours. You're getting ready to go in an interview and you're freaking out and you're thinking all these negative talk, that you have, because we are our own worst enemies. You're an amazing coach. You've coached me. I know how amazing you are as a coach, but I also know that what's going on between my ears drowns out everything that you bring to the table, because we have all this negative talk. But if now we're using something that's going to calm us down, that's not going to make us addicted or dependent on it, like a benzodiazepine, like alprazolam or diazepam, clonazepam, that we become dependent and addicted on this. And to get off of it, it's easier for me to get somebody off of heroin than it is to get them off of a benzo. But now I'm giving them a plant that's natural, that they can use in different ways, and it has the same benefit without the side effects. Now it's to their benefit. But now your radio listeners, your listeners are going to be saying, well, wait a minute. I get my medical marijuana card, or I'm in New York or New Jersey or Connecticut where it's adult use. I can walk into any dispensary and get what I need. But what if I'm drug tested? What then? Now, a lot of states are doing away with testing for cannabis. They're no longer doing urine drug screens for cannabis as a pre-employment screening, because 37 states and or territories have either a medical cannabis program or an adult use program. Puerto Rico has a medical program. Florida obviously has a medical program. I just mentioned 3 states in the tri-state area that have an adult use program. So if that's a challenge for you or you're concerned, bring it up right off the bat. Address it with HR and say, look, I'm a medical cannabis patient. I use medical cannabis. I live in New York. It's legal here. What's your policy on that? Do you have a zero tolerance? Because if they have a zero tolerance, guess what? Not only are you not going to be able to use your cannabis, you're not going to be able to use your pain medication or your anxiety medication or maybe even your depression medicine, because of the side effects that those medications have. So these are questions that you need to come in, just like they're interviewing you, you need to interview them, just like you teach, to learn, is the dynamic mutually beneficial, and am I still going to be able to use my medicine?
Great share there. Absolutely. So, are there any? I mean, we can go into all the bugaboos and stereotypes, and talking about mom and 94 and Yeah, you're crazy. Um, what are some of are there any side effects? Do I just walk into a dispensary and say I want an inhaler? I mean, is there a prescription? How does that work out?
Okay, well, prescriptions are not allowed, and I'll tell you why. Because it's still federally legal at this time. November 20th, 2024, cannabis remains a Schedule 1 drug in the United States. That is defined as not medically beneficial, high level of addiction dependence. However, understand that the synthetic version of cannabis, a product called Marinol or Nabiximol, two products, the trade names are Marinol and Sesamet, synthetically made in a lab, are Schedule 3s. And a product that's made from hemp, from the actual hemp plant, that is indicated for children with intractable seizures, two in particular, Lennox-Gastaut and Dravet's, comes from the hemp plant, is called Epidiolex, used to treat seizures, a Schedule 5. But yet, cannabis in its natural state is equated to heroin, MDMA, ecstasy, PCP, angel dust. So there you have it. Fentanyl is a Schedule 2. Adderall that we give our children with ADD is a Schedule 2. You can give a child Adderall but they can't have cannabis because, oh no, marijuana is addictive. Well, how about amphetamines? Because that's what Adderall is. That's what Vyvanse is. That's what Concerta is. So, so it's not a prescription. It's a recommendation. We're using our First Amendment right of freedom of speech to recommend cannabis. As far as what to get, that's where I'm a big advocate and proponent of a medical program because you can go into a doctor that has some knowledge, some understanding. Just like you have a heart problem, you go to the cardiologist. You have, lung problems, you go to the pulmonologist. You're having issues with your digestion, you go to the gastroenterologist. This is just another specialty. You come to a medical cannabis doctor, ask them, look, these are my conditions, this is my situation. What do you recommend I take? How do I take it? How do I go about it? And that's how we work, you know, in tandem together. Just like you're their career coach, I am their health coach. And this young lady that I saw today with the lupus and all the other conditions that her lungs are messed up, she's taking 20 pills a day. She wants to wean off of those pills because her life revolves around her cell phone alarm reminding her, okay, it's time to take this pill. It's time to take this pill. It's time to do this. And that's no way to live.
Agreed. That's you're sharing that my niece has that, lupus, and so I have to follow up with her and just find out what's going on. So, we could go on, and certainly we're going to have you back and sharing, and probably on our weekly workshop as well. But what's the best way for folks to reach out to you? Just, touch base, get more information, because, you know, just for those in our generation in Gen X, it's just something that's not, it's almost for some just taboo. We just don't know. And there is fear in anything related to
Mhm.
let's take a lorazepam versus X.
Yeah,
What's the best way for folks to reach out to you, Doc?
sure. Absolutely. My website is josephrosadomd.com. josephrosadomd.com. I'm also on Instagram, dr period Joseph Rosado. I have a YouTube channel called the Dr. Rosado Show. I've got videos on there, both in English and Spanish. On my website, you'll find that there are 7 books that I've published on the topic. The first book, Hope and Healing, The Case for Cannabis, is available in English and in Spanish, as well as on audio. All of the other books and that one are available on Kindle, so you can get them electronically. So you have those on YouTube. I've also done some lectures that have been recorded lectures that I've done in Canada, lectures that I've done here in Florida, lectures that I've done overseas, courses that I've taught both locally and internationally, and two interviews that I'm very proud of. One with Montel Williams, who's from our neck of the woods,
Sure, sure.
and he has multiple sclerosis, and he's a major advocate and proponent of the use of cannabis. And so he's interviewed me, and we've had many opportunities to share knowledge and information. And another one that's also from our neck of the woods, from Long Island, Jordan Belfort, also known as the Wolf of Wall Street. That interview is also available on YouTube. That one, I have to say that it's not meant for all ears. It could be PG-13, maybe pushing R, because, it is Jordan Belfort from Long Island. So, but those are the best and easiest ways to get a hold of me, or through LinkedIn. I'm on LinkedIn, obviously. I am your friend. And so I'm on LinkedIn.
Yeah.
And so you can reach out to me in any one of those platforms.
Now,
Uh, Go ahead.
is reaching out to you regulated in any way? Meaning, could someone from New Jersey and that you're working in your practices in Florida, are there any restrictions around that, or just no? It's since it's not regulated, from that standpoint, is there any concerns there?
As long as I am not prescribing, which I can't prescribe, I'm making a recommendation, I'm okay. Um, It's when I prescribe because I'm not licensed in the state of New Jersey or New York, then I can't write a written prescription because the pharmacy won't honor it. But because it's federally illegal and we're all practicing uh, based on recommendations, I can, and I'm not treating them. What I'm in essence doing is sharing information. So if someone comes to me and says, you know what, I've been on, I've been diagnosed with this condition, and I'm on these medications. What do your patients take that have similar conditions to what I have? Like your niece, for example, that has lupus. Well, I saw two people today that had lupus. Okay, well, based on my experience with my lupus patients, this is what they use. This is how they use it. This is what their results have been. This is what I've recommended for them. See if in the dispensaries where you can go to, they have these products. And that everybody's legal and above board.
Got it. So if I'm at the dispensary, I'm like showing you the picture on my cell phone. Is this is it? Is this it? Is this is the one? This is
I can give you a thumbs up or a thumbs down.
exactly, exactly. Dr. Joseph Rosado, buddy, my friend, thank you so much. Really appreciate it being here, and I'm sure folks look take advantage. I've known Dr. Joe for many years, great man, and he's probably one of the you know, those who open up the doors to this. I mean, he's been working in this area for as long as I could remember. And there's nothing like having a lot of wise and some wisdom and advice on this area so that if what you're working is not, or you want to think of something more natural, certainly pick up that. But we'll continue on with the mental health and mental wellness on as we continue. So thank you, Dr. Rosado, for your time today.
Always a pleasure, Rodrigo. Give my love to the moms.
All right.